This is the news in brief from the United Nations. At Ukraine's stricken Chernobyl nuclear plant, staff that have been working there non-stop since the Russian invasion have finally been able to return home. The development on Monday followed deep concern expressed over staff welfare there by Mario Grossi, head of the UN Atomic Energy Agency IAEA. In a statement on Sunday, Mr. Grossi said that they'd been carrying out their important work under immensely stressful and tiring conditions in the presence of foreign military forces and without proper rest. Staying with Ukraine, the UN Rights Office OHCHR has reported that more than 900 civilians have been confirmed killed and nearly 1,500 injured since the Russian attack. Most of the victims were hit by shelling from heavy artillery, multiple rocket launch systems, missiles and airstrikes, although the true figure is likely far higher, the Office of the High Commissioner for Human Rights said in its latest update. Getting verifiable information about reports of numerous civilian casualties is proving difficult from many Ukrainian cities and regions which are still being pounded by Russian shelling, OHCHR stressed. In Democratic People's Republic of Korea, DPRK, more commonly known as North Korea, human rights violations remain systematic and the authorities' grip on the population has tightened, the Human Rights Council heard on Monday. The forum's UN-appointed independent expert, Thomas Quintana, reported that the situation had worsened because of COVID-19 prevention measures, exacerbating a humanitarian crisis.
Chronic food insecurity continues to be widespread in the Democratic People's Republic of Korea, with the numbers of food insecure people consistently above 10 million, representing over 40% of the country's population.
Prolonged border closures and restrictions on movement have shut down markets that many people use to get the basics, the rights expert warned. He also highlighted the policy of shooting individuals who attempt to enter or leave the country without permission, in reference to buffer zones set up on the border with China and Russia. The DPRK delegation was present at the Human Rights Council but declined to respond to the report. Climate issues now and a warning to the world's richest nations from UN Secretary-General Antonio Guterres on Monday that the target of keeping global temperatures to within 1.5 degrees of pre-industrial levels is on life support. The problem is and has always been the enormous emissions gap that's created in the main by industrialized countries, Mr. Guterres told the Economist Sustainability Summit in a fresh appeal to achieve a 45% reduction in global emissions by 2030 and carbon neutrality by 2050.
Last year alone, global energy-related CO2 emissions grew by 6% to their highest level in history. Coal emissions have surged to record highs. We are sleepwalking to climate catastrophe.
Mr. Guterres told the summit that the planet has already warmed by as much as 1.2 degrees and that climate disasters in 2020 had forced 30 million people from their homes. He urged developed countries, development banks and the private sector to unite to deliver green technology to emerging economies that are so reliant on coal for their energy. And as Russia's war in Ukraine continues to unfold, Mr. Guterres also warned against any short-term measures that countries were considering as an alternative to Russian fossil fuels. These stopgap policies would only close the window to the 1.5-degree target, the UN Secretary-General insisted, in a call to massively increase climate finance to the tune of trillions of dollars. Daniel Johnson, UN News. This is the news in brief from the United Nations. UN Chief Antonio Guterres on Tuesday said that it's time for a diplomatic solution to be found to end Russia's invasion of Ukraine and end its unwinnable and indefensible war there. The Secretary-General was speaking to journalists outside the Security Council in New York, telling them from his own outreach efforts, elements of diplomatic progress were coming into view on several key issues.
The war is going nowhere fast. For more than 2 weeks, Mariupol has been encircled by the Russian army and relentlessly bombed, shelled and attacked. For what? Even if Mariupol falls, Ukraine cannot be conquered city by city, street by street, house by house. The only outcome to all this is more suffering, more destruction and more horror as far as the eye can see.
Nearly a month since Russia invaded Ukraine, more than 3.5 million refugees have fled the country, UN humanitarians have said. In Poland, where 2 million Ukrainians are sheltering, the World Health Organization, WHO, said that many refugees had chronic healthcare needs, requiring urgent assistance. Here's Dr. Palomi Kuci, WHO representative in Poland.
As you can imagine, access to healthcare in Ukraine is very restricted. And on top of that, refugees are coming from a long, difficult, dangerous journey, until they arrive to the border of Poland. Children are traveling for days without the proper food, without the proper water. They are tired, they are worried.
The development comes amid reports that Russian shelling has continued to target heavily built-up areas inside Ukraine. Latest UN Health Agency data has now confirmed 62 attacks on healthcare inside Ukraine since Russian forces invaded on the 24th of February. Reflecting the global commodity price crunch made worse by Russia's invasion of Ukraine, UN humanitarians in Haiti warned that it would likely hurt vulnerable people in the highly import-dependent island nation. In an alert on Tuesday, the UN World Food Programme, WFP, warned that hunger levels in Haiti were rising unabated amid persistent political instability, growing inflation and recurrent disasters. Much of the island's wheat comes from Russia and Canada, said WFP country director Pierre Honorat.
So if the wheat flour is going up, you will see a problem. And as I say, the price has already multiplied by 5 in 2 years. So what we can only expect is that it will multiply again.
Needs remain high in the southern part of Haiti, where communities are still reeling from a devastating earthquake that hit in August 2021. In the north, heavy flooding in January hit Haitians hard, prompting WFP to scale up its response with daily food deliveries. More than 4 in 10 Haitians are food insecure, including 1.5 million who require an emergency response. In Mozambique's Cabo Delgado province, unrelenting violence and bloodshed has forced thousands to flee their homes since the start of the year, the UN refugee agency UNHCR said on Tuesday. It comes 1 year after attacks in the northern coastal town of Palma by suspected al-Shabaab militants who began an insurgency in 2017. UNHCR's Boris Cheshekov told journalists in Geneva that attacks by non-state armed groups between January and mid-March had displaced 24,000 people in Nangad district in the far north. They need humanitarian assistance and protection services urgently, said Mr. Cheshekov, who added that hundreds of families are reportedly still on the move.
Those fleeing violence suffered and witnessed atrocities, including killings, the decapitation and dismemberment of bodies, sexual violence, kidnappings, forced recruitment by armed groups, and torture. The threat of renewed violence means the number of people arriving in Weda continues to increase.
UNHCR is working with partners and local authorities to help the displaced. It is providing shelter materials and household items to vulnerable families, monitoring those with protection needs, and supporting authorities to manage sites hosting the displaced. Daniel Johnson, UN News. This is the news in brief from the United Nations. A month since Russia's invasion of Ukraine, people's health needs there are dire and getting worse, UN Health Agency Chief Tedros Adhanom Ghebreyesus said on Wednesday. The situation is particularly critical in Mariupol and elsewhere, Tedros said, where the World Health Organization, or WHO, has not been able to dispatch a humanitarian convoy because of the ongoing violence. Other Ukrainian cities have received 150 tons of medical supplies from the WHO hub in Lviv in western Ukraine, but access to many locations remains blocked. Tedros issued an appeal to Russia to stop the war before condemning ongoing attacks on hospitals, patients and medical staff.
WHO has now verified 64 attacks on healthcare since the start of the war, and we are in the process of verifying further attacks. Attacks on health must stop. Health systems, facilities and health workers are not and should never be a target.
UN Chief Antonio Guterres set an ambitious 5-year global deadline on Wednesday to ensure that people worldwide are protected by early warning systems against extreme weather and climate change. Marking World Meteorological Day, Mr. Guterres said that early warnings and action save lives. He added that the World Meteorological Organization, or WMO, would lead the effort and present an action plan in November at this year's UN Climate Conference, or COP27, in Egypt. Mr. Guterres warned that human-caused climate disruption is now damaging every region and that it was unacceptable that 1/3 of the world's people are still not covered by early warning systems. This mainly involves least developed countries and small island developing states, and the situation is even worse in Africa, where 60% of people lack early warnings on storms, heat waves, floods and drought. World TB Day is marked on the 23rd of March, and this year the World Health Organization, WHO, has called for urgent investment in the fight against tuberculosis to save millions more lives. Although TB is preventable and curable, it remains one of the world's deadliest infectious killers. Each day it claims more than 4,100 lives, and close to 28,000 people fall ill after becoming infected, and this despite the fact that 66 million lives have been saved since 2000. The need for global action is more urgent than ever, the WHO said, as the COVID-19 pandemic has reversed years of progress in preventing TB transmission, meaning that for the first time in over a decade, TB deaths increased in 2020. Conflicts across Eastern Europe, Africa and the Middle East have made vulnerable populations more susceptible to TB, underscoring the need to ensure that commitments made by global leaders to end TB are met. The UN Health Agency said that global spending on TB diagnostics, treatments and prevention in 2020 was less than half of the annual global target of $13 billion. For research and development, an extra $1.1 billion per year is needed. In Kenya, a sustainable agriculture project has helped farmers move away from the harmful practice of growing tobacco in favour of a healthier alternative, the UN said on Wednesday. The scheme offers training to tobacco farmers so that they can switch to alternative crops that are easier to harvest, such as beans. So far, growers have sold 135 tonnes of beans to the World Food Programme, or WFP, providing them significantly more income than from tobacco farming. Growing beans has the added advantage that they're full of iron, which helps to counter numerous health and development problems among children and pregnant women. The project has seen farmers' health improve, increased school attendance from children previously working on farms, and better crops for the environment replacing tobacco, said UN agencies WHO and FAO, who noted that tobacco farmers and their families are exposed to serious health risks from the nicotine that is absorbed through the skin when handling wet tobacco leaves, exposure to heavy use of pesticides, and to tobacco dust. Daniel Johnson, UN News. This is the news in brief from the United Nations. In Ukraine, more than half of the country's children have now been displaced since Russia invaded exactly a month ago. UN Children's Fund UNICEF said that 4.3 million children are on the move. This includes more than 1.8 million who've crossed into neighbouring countries as refugees and another 2.5 million who are now internally displaced inside Ukraine. UNICEF Executive Director Catherine Russell described the development as a grim milestone that could have lasting consequences for generations to come. And she warned that youngsters' safety, well-being and access to essential services were all under threat from non-stop, horrific violence. Data analysis on unintended pregnancy and abortion from 150 countries has revealed major disparities in accessing sexual and reproductive health care, the UN Health Agency WHO said on Thursday. With partner organisation the Guttmacher Institute, the WHO said that the results would allow health authorities to better understand family planning needs in their countries, including contraception and abortion care. According to the data, which represent the first such exercise at a country level, unintended pregnancy and abortion rates vary widely, even within the same region. The greatest variations are in Latin America, where unintended pregnancy rates ranged from 41 to 107 per 1,000 women, and in sub-Saharan Africa, where the range was 49 to 145 women per 1,000. Even in regions with low unintended pregnancy rates, it is still hugely important to invest in giving women and girls the information they need to choose whether they want to have children, said the Guttmacher Institute's Jonathan Bierak, whose study appears in the journal BMJ Global Health. Sexual and reproductive health and rights are an essential part of universal health coverage and are required to end discrimination against women and girls, the WHO said. Russia's invasion of Ukraine has been the main contributing factor to the potentially devastating 1% drop in projected global economic growth this year, UN development economist UNCTAD said on Thursday in the body's latest global economic update. This year, the world economy is forecast to grow by 2.6%, down from the rosier 3.6% forecast made last September. Rising inflation is making matters worse for developing countries already weighed down by a $1 trillion debt burden to pay back creditors, the UN body said, adding that they've had insufficient support to help them withstand exchange rate instability, rising interest rates and soaring food and fuel prices. Here's UNCTAD Secretary General Rebecca Greenspan.
We are asking for the strengthening of the measures that will help developing countries to cope with this situation. It's very important to activate the immediate funding, the rapid funding instruments that the IMF has.
UNCTAD noted that even relatively wealthy countries have already sought help from the international banking system, including Pakistan, Sri Lanka and Egypt. Daniel Johnson, UN News. This is the news in brief from the United Nations. Ongoing violence in Ukraine has left millions of people in constant fear of indiscriminate shelling, the UN warned on Friday, as efforts continue to push for access to the country's most vulnerable populations. 1 month since the Russian invasion, 13 million people are estimated to be stranded in affected areas or unable to leave Ukraine, including in the devastated port city of Mariupol. Carolina Lindell-Billing, UN Refugee Agency representative in Ukraine, said that civilians faced dangers including destroyed bridges and roads, as well as a lack of resources and information about where to find shelter.
In eastern Ukraine, in Kharkiv, Donetsk, Luhansk Oblast, as well as in the south, Kherson and Kiev. And they are blocked in these areas that are encircled or where the roads are now inaccessible due to mines and, for example, burnt out vehicles. This has been one of the reasons why it's so difficult to get to Mariupol.
Since February, the UN and partners have delivered over 2,700 tonnes of food and medical supplies to Ukraine and more than 1,100 tonnes of water, sanitation and hygiene items. All the while, the civilian death toll continues to rise, and the UN Human Rights Monitoring Mission in Ukraine said that the overwhelming damage and destruction so far has been caused by explosive weapons with wide impact areas which are being used on a daily basis in populated areas. Addis Abeba's announcement of a ceasefire in Ethiopia's Tigray region on Thursday has been welcomed by UN Secretary-General Antonio Guterres amid deep concern for the 5 million people who need emergency food aid there. The development came as Tigrayan forces on Friday said that they would respect the truce, urging unfettered aid deliveries to the northern region, which last received assistance in December. Mr. Guterres said that he hoped the truce will translate into an effective cessation of hostilities, respected by all parties in this conflict, to allow for effective humanitarian access for all who need it. His spokesperson said, "Civil war erupted in Tigray in November 2020 between federal troops and forces loyal to the Tigray People's Liberation Front. All parties to the conflict are responsible for multiple grave rights abuses, according to UN Rights Chief Michelle Bachelet." To Libya finally, where civil rights defenders and others have been forced to confess to supposedly anti-Libyan values, including supporting feminism and atheism, according to the UN Rights Office OHCHR. In an alert on Friday, spokesperson Liz Throssell expressed concern at deepening repression of civil society in Libya involving torture and harassment off and online. She said that arbitrary arrests by internal security agents and state-affiliated armed groups had taken place, targeting human rights defenders and civil society actors under the pretense of protecting Libyan and Islamic values.
7 men, aged between 19 and 29, were arbitrarily arrested and detained by the Internal Security Agency in Tripoli between November 2021 and March this year. The ISA has since posted videos of the 7 men on Facebook in which they seemingly confess to being atheist, irreligious, secular and feminist, and to using social media to propagate atheism and contempt for religion.
A series of Facebook videos have also sparked a wave of hate speech against human rights defenders, the UN Rights Office said, noting that the names of activists had been circulated online with calls to prosecute them and put them to death if they're found guilty. Daniel Johnson, UN News.